Good morning. Happy Tuesday. Okay. Good morning, Simone. Wow, we have a great group today. Yay! To office hours for the master class at Public Health Hired. My name is Zoila. Welcome if this is your first time, and welcome back if you are a recurring participant, colleague of ours trying to get hired or just learning about the job market. This is very open-ended. For those of you who aren't aware, I think for the most part, you should know that your purchase of the masterclass comes with a one-time Zoom session with me. So make sure you have that time with me when you need it. If you've already used it, that's great. If you haven't, it's still available to you. There is no expiration on that. You have unlimited access to all of the material, e-course material. I have been promoting that I'm going to update it. As you can imagine, that has been the plan and continues to be the plan, but was pleasantly and unpleasantly surprised with all of the uproar from the changes at the federal level. So it sort of like interrupted my process of me wanting to update all the content. All of that to say that regardless of when I update it, you will have access to that new information. Yay. So everything is available to you, unlimited, no extra cost with the course inside the publichealthhired.com login course. And then obviously this session where we have weekly group office hours where it's really meant for us to get our questions out, burning questions out, hear each other out, have an opportunity to connect what's going on this week. This has been a great opportunity for those of you who are really just trying to get a sense of the landscape of the job market as just changes are happening. So if you've been coming, I hope it's been helpful for you to kind of, kind of calm the nerve, so to speak. So, this is a safe space. There's no dumb question. You're also welcome to introduce yourself in the chat during this time. Drop your LinkedIn profile. All of that is welcome. So we have a good group. We have about 12 of us, it seems like. So anybody want to kick us off? I hope I can hear you guys. If not, I'll have to. Can someone try to go off just to see if I can hear you?
Hi, Zoila, can you hear me? This is Yuko.
Yes. Oh, hi, Yuko. Thank you. Yes,
Perfect. I did
great.
have a question.
Yes, go ahead.
I have a couple of questions, but first question is, so I've been very frustrated by the fact that it takes me so long to tailor my resume and do the cover letter and apply for jobs. I feel like I haven't yet gotten the full grasp of that, and it takes me a while. And I went to this like career resource webinar, and they were like, you should be applying to multiple jobs a day, and they were like really pushing it. So I'm just wondering, like, how many hours should I spend on one job application?
Oh, great question. So how many hours should you spend on one job application? It can range. Sometimes it's a couple hours to 4 hours to a couple days because then you realize you overlook something sometimes, right? So it's happened to me where I thought I was done and then I just double checked if I got everything and I like missed something. You know what I mean? So I don't like to put too much pressure on you guys to do multiple day. If you followed long enough, you'll hear that I only recommend 1 to 3 a week. Okay. 3 a week is you're doing rock star level work. That's 3 per week. Like that's one every other day. And that's because it does take time for you, number one, to find the right fit. Finding the right fit is half the battle, right? You go finding like the one that feels like, and you're not looking for the one, you're looking for a job description that speaks to your skill set enough for you to want to apply. Maybe it's a little different than what you thought it would look like. I ex I ex I let I encourage you guys to let go of titles for that reason, right? So that you can really just focus on the duties and the qualifications. But I get really concerned when you're hearing that people are encouraging you to apply multiple a day because you're just at that point just sending, and the thing is there are my mentees who get in certain tracks like you do build momentum. So maybe you're just asking a question of like, when do I feel like I'm in my flow and things are not so hard? And I'll tell you that it's never going to really be quote unquote easy. It's never going to feel like, oh, okay, this is like, up until the day that my mentees get a job offer, I'm still encouraging them to apply as well. So I'm not someone who even lets go of the applications just because you're getting callbacks, right? I'm someone who says keep applying until you get that job offer in writing. So, but at the same time, that doesn't mean you just apply senselessly. If you do find some that are similar enough, right, which happens, some of my mentees will be like, hey, thanks for tailoring this one. I used it for this other one that was similar. Great, great. This one was a research assistant. This one was a research associate. They're about the same kind of work, not just changed a couple things. Great. That one was. So start to organize your work if you want, as far as like, these are this type, these are more about, data analysis. These are more about report writing. These over here are more about project management, right? These over here are more about partnership and stakeholder engagement. Now, obviously, that also comes with its issues because some of these jobs want like 30% data management, 30% stakeholder management, 30%, right? Project management. So you can't be so, even rigid on how you categorize these because they're not black and white either. So all of this to say, I think do what you can to organize the types, right? I just simply ask my mentees to organize per company. I don't ask them to go beyond that. I also don't recommend that you track on this work. I think that's really up to you, but I think it gets really daunting and depressing when you're tracking on top of it all. Like if you're applying to all these jobs and then you're just managing to no one calling you back, that also gets really hard. So there's not really like 1 to 3 a week. That's what I recommend. 1 to 3 a week.
That's how I was feeling.
Okay.
But I think my next question was like, so my job, I lost my job and they offered me like 3 months of career consultation service. And I've been going to the webinars and getting conflicting informations that are very different from what I'm getting here because it's not tailored to public health industry. And
Correct.
there's also like status offering, career coaching service, and like resume tailoring service, which I also signed up for because I thought that could give me like state specific jobs.
Okay.
I don't know yet, but I'm wondering like, should I be doing these things on top of working with public health hired method, like, or would just
So, okay,
confuse
so hold on.
me?
So are you getting this information from state agencies?
No, so there's like um I don't think it's Illinois specific, but there's like an agency that's offering um resume tailoring and other kind of general career services for people who are
Yeah.
looking for work. Um, so yeah, I'm kind of going to work with a coach, but because it's
That's
free.
the thing. Yeah, that's the thing. I think, at the end of the day, you all are, your own free agent and you're here just to also learn what I have to offer. And if, it's not uncommon for you guys to be seeking services and support in other areas. I follow other career coaches and career service, you know, um, consultants and everything. So I get it. But I think from what I'm telling you is like, this is the only thing that has worked for me, that has worked for those that I help. This is how I help my mentees, right? So all I can do is be honest with you about this is the process. And yes, it still takes 4 to 8 months to get hired, right? So I think some of us get a little frustrated at a certain maybe 4 month mark, 5 month mark, 6 month mark. We're like, what's happening? Why is nothing happening? And that doesn't mean all is lost. It could still mean like you finding the right fit, you getting callbacks from companies 3 months ago that you applied to, right? In fact, this is the number one question I'm getting because folks know the mentorship enrollment ends today. And they're like, do I wait to try and just because, people are laid off right now, unfortunately, are wondering, do I just try myself? Like, do I just try for a while? I'm like, sure, yeah. I mean, that's totally up to you. Like there's, that is you are a free agent, but the other thing is you quickly realize how hard it is a month in, right? And then you're like, "Oh, this is not as easy as I thought it was going to be." So I think it's really, there is no perfect answer to this. All I can do is tell you, these are the tools, this is the process. I can point you to better options. That's why we do job searching together. That's why I do the job alerts. That's why I try to give you the key terms guide. I'm doing the mind mapping with you for the, career clarity workshop. Like there's so much to kind of keep digging, right? You go. So I'm just trying to be honest with you about the career coaches that you're following and those that are traditional tell you you just need this one resume. They revamp it a whole other way that I would never revamp it. They tell you to apply to multiple a day, right? There's a lot that I don't agree with that has never helped me, hence why I had to figure it out myself. Hence why I just had to kind of keep feeling it out in the dark. Like, what is this like nebulous negative space that I'm in that no one is giving me a job offer? And from all of that, this is it. Like, this is the process, which is why I feel like, sometimes these weekly check-ins are good for me because I'm like, are you guys okay? Because this is hard. Like this, I I know, right? So I'm just letting you know you're going to keep hearing this. You're going to keep hearing family tell you you should change jobs, right? Have you heard that yet? Like everyone's hearing that. Everyone's like, "Oh, like my family already didn't like my choice and degree or the fact that I'm sticking to public health, and now with everything going on, they're like, "See, you should just go be a bank teller. You should just go be a teacher. You should just go do this, go do that. You're wasting your time." So like those things I can't control, but all I can do is continue to, support and motivate and just remind you that you're doing the best you can. Don't listen to the noise. Don't let people compare like, "Oh, you're only doing one a week. You should be doing 10 a day." Like no one I know, there's no one I know who got hired that way. Not in public health, maybe accounting, maybe retail, right? Maybe banking. Sure. Go at it. But not public health. Not public health.
Do you know why that may be? Like why public health industry requires like a lot of tailoring compared to like other industry because it's very specific?
Actually, the opposite. It's because it's so broken. It's so broken up. Everyone wants to define it their way. Everyone usurps public health to their own benefit and their own company, to look good, to provide, to give meaning, to build presence in the community, to build partnerships, right? The essence of public health is to prevent, right? We're here to help with prevention, policy changes, system changes, monitor things, surveillance, reporting on things that are outbreaks, right? But due to the nature and the goodness of public health, right, it's used through these companies for corporate social responsibility, social impact, philanthropy work, right? Research. Universities use it for like extending, themselves into the community and providing services at the schools. To me, it's not because it's specific, it's because it's defined across all these sectors differently. Right? Which is why in the masterclass, I remind you guys that part of your job search is to be mindful if you're seeing a diversity of sectors, right? If you're job searching and you're, typing community engagement and all you see is healthcare companies and government, well, then you're in a loop because you should be seeing private organizations, right? For-profit associations, universities, research, healthcare, right? Those are the different sectors. So I'm so glad you asked that question because it's actually the opposite. And it leaves it up to us, Yuko. It's the onus is on us, the candidate, the workforce, to be like, "Oh, how do you guys talk about global health? How do you guys talk about women's health? How do you guys talk about?" How do you talk about chronic disease? How do you talk about infectious disease? Communicable disease, foodborne, zoonotic? Like, how do you guys talk about it? That's why we're in this mess. And actually, this is a good pivot. I see Cynthia, your hand is up. This is a good pivot to me, maybe job searching with you guys, because I'm noticing the changes literally on a daily basis. For those of you who want DEI jobs or wondering where the DEI jobs are, is anyone going to do any more DEI, diversity, equity, inclusion? Yes, they're changing it to equity, belonging, and engagement. The language is now equity, belonging, and engagement. Like I'm seeing the word belonging on titles. The word belonging has never been on titles. So that's where we're going. Like the companies are trying to find ways to keep the work and sustain the work and be in good faith. Like, I feel like what's been happening is a lot of companies are going to be tested as far as stepping up, right? Like how is healthcare going to help with the gap? How is philanthropy going to help with the gap? I think I've been eyeing, just wondering how the pivots are going to happen, and I'm already seeing it just in their titles, just in how they're reshaping the work. So it's not that the work is gone, it's just that it's redefined now. Like I may have to do like a, update to the key terms guide by the end of the year, because I don't know what this year is going to hold for us. But all I can do is try to, like, keep disclosing, this is what I'm seeing. These are like, this is the language, this is what's happening, right? So just as a heads up, it's going to be quite a ride this year. Cynthia, question. Go ahead.
Hi,
Cynthia,
Zoila.
hi.
It's not, I'm so sorry. So this is a question that's kind of weird because I don't know if it's like personal, but not personal. I did an interview last week and they went, I think it was just with the HR screening. So it was just really like methodical and questions like very structured. And when they asked, okay, so the job description says X number of years. How, like, do you have this? And then said yes or no. It's like a yes or no question. And then it's, do you have this degree? Yes or no? And I'm like, okay. But then as you were saying, what defines the experience? The second thing is they saw that I had an internship because it's listed as internship. And then most of the time internships are unpaid. Mine was listed as paid because American Heart Association actually paid me to do the internship. So when they asked, is your internship, well, what about your time at American Heart Association? Was that paid or unpaid? And I said, paid. And I said, oh. And then they counted that as experience. And then the next thing was like, say, like I put another internship on there, but this one was unpaid. They therefore left that out in the rest of the interview, even though it is a really substantial, it can be considered really substantial. So sometimes the work that we do, even if it is a volunteering thing, even if it's you're sitting as a board of directors sometimes, how do you kind of define all of that? Because when they did the interview, they went ahead and said, okay, well, tell me about what you did at American Heart Association, even though it was 6 months. And even though that wasn't feeling like to me the most relevant part of what should have been the discussion or the interview. And then like, what do you do about when public health becomes whatever you want it to be to define as experience, maybe?
This is a really okay. First of all, congrats on the callback. That's a major win. But I think you're running into now where the rubber meets the road, right? Where they're now going to challenge you in defining what you know as your experience. Now, it's rare for a company to actually ask you to break it down, paid versus unpaid, to that detail. I've never heard anyone do that I mean, not never, but it's rare. I would say it happens like 5% of the time. So you're experiencing something that hopefully you won't experience again, because I've never been in my entire like career. The
Yeah.
only time, actually, I take that back. When this tends to happen is more towards the end, when they're already going to give you the offer and they want you to fill out the employment information. In other words, your employment background, and then they want you to disclose whether it was paid or unpaid. But by that time, they've already told you that you're their final candidate. So I've experienced it the opposite, where like they still want me to disclose my experience, but it'll be after the fact. And sometimes, yeah, they're like, oh, okay, was that, was that a volunteer role? And they're just trying to get a sense of whether it was paid or unpaid. And you can be honest about like, yeah, I was volunteering, but it was a stipend. Sometimes I've gotten a stipend. Well, is that going to be
Right.
defined as paid or unpaid? Like, what are you,
Right. That makes a lot of sense. Right.
you know what I'm saying? So be mindful of the quote unquote traps of their own semantics of like, because I know I didn't get paid by an organization, but I got a stipend because of some other foundation that wanted to give me
Mhm.
a stipend due to my work. So to me, that was paid, but yet unpaid in someone else's eyes. So I think it, if you feel like they're really just trying to get a sense of, you have to be honest, right? You can't, if they're straight up asking you, was it paid or unpaid? That's all you can do. But I'm also letting you know, Cynthia, to not let this sort of beat you down, because the goal is to get you to the table, and you got there, right? You got
Right.
to the table.
Right.
I'm talking to someone. Finally.
Yes, someone saw the feels. Someone saw
Yes.
the feels.
Yes.
Okay.
Yes. Okay. This is a call. This is finally gonna like, the practice is happening. So that I want you to feel like you've crossed that mark. But I think going back to their questions and them being too rigid on that, don't feel like that's going to be every process. For example,
I wasn't fixated on this, like, well, was your internship paid or unpaid?
okay.
It was when they conducted the interview, because one of the internships was actually a very long one, and it's like a project now, and that could be considered actual substantial experience, but because it was answering the question, it was unpaid, they didn't ask anymore, what did you do in this role? It was just completely,
No, okay. In that sense, if it
yeah,
seems like they were trying to
that's,
they're trying to deduce
yeah,
whether to count the experience. And I think if you wanted to still get it in there, as far as like, yes, it was unpaid, but it was significant enough in the sense that X,
okay.
right? It was significant enough in that it qualifies me for like the community engagement aspect of the work, or I was
Right,
ingrained in it for full time for a month. Like there's ways for you to at least just add the
right,
just
in
put
the
an
question,
asterisk.
right.
Yeah, because keep in mind, this is what I try to remind my mentees when we're going through this kind of process of like the screening, the quote unquote screening, it's really just an interview, is that you all are like, oh, but the HR person doesn't care about that. Or why would I ask? Because I tell you guys to have a really good question. So Cynthia, I hope you had like a project or program related question for them that was like about the work. Because what happens is even if they can't answer it, it's that they're taking notes back to the hiring manager. They're
Okay,
writing down what you're saying. So most of the time when they trump the HR person with the question like, oh, that's a great question. I don't know the answer. I'm not part of the team.
right.
Let me tell the hiring manager you had this amazing question. That's enough. That's enough. So I'm just kind of, warning all of you that some of you think of it as a screening as like, oh, this is just the HR person. No, they're representing the entire team.
Okay,
Okay.
yeah.
Don't feel like, yeah, you may still have passed. You may still get a call back. You don't know. You don't know. Yeah. Congrats. Congrats. You
Thank
did
you.
good.
Thank
Yeah.
you.
You did good. Okay, I'm gonna see there's a question. Good morning. Good morning. It's so broad. Yes. Zoila, hi Alicia. Do you talk with employers a lot too on what they are looking for with these pivots? Alicia, yes and no. Are you talking more about like, do you talk with employers on what they are looking for with these pivots? You mean like the funding or the language?
Yeah, I think more on the language from the earlier discussion when you were talking about equity and the like the
The
changes in that.
belonging.
Yeah, and what and just like also from candidates right now and what they might be looking for with these pivots. But that was the question.
Yeah, I think for most of what I'm hearing is like people are trying to figure out where is it safe, right? So I think from you all, I'm hearing where is it safe? And from the employers, I'm like, how do I still let them know that we're hiring? Because there's a lot of like local and state work that's hiring. Actually, a lot of local work because a lot of local counties are funded by like business taxes, right? Retail or fines that they collect. So there is a lot of like local work being funded just naturally from their own community that's not impacted by the federal funds. And they're hiring. And so I think it just comes down to, some of the work is still the same, right? So that's good in a lot of ways. Like a lot of times I'm still seeing humanitarian work or HIV work. Research is still being, you know, they're still recruiting for. So there's still work out there, but I think given the nature of the language that's evolving or how some companies might hide the work versus your understanding of the work, there's going to be like a weird overlap of catch up of how they're defining or redefining the work or holding, or holding their ground, standing firm in it, right? I think it's hard to say if a company is going to redefine the work or repackage it, or if they're going to like stick to what they've already been doing because it doesn't really impact them. And they're an influencing organization themselves, so they don't feel as threatened. So I think we're going to see a little bit of both, to be honest. It just depends, Alicia.
Thank you.
Yeah, of course. Another question, should I be going to job fairs and networking events? The other day I went to a state job fair for the state. Yes, but they were just giving out the information I can find on their website. Oh, yeah. I get this question about like how much effort to put into getting out there, and I would say it depends because some career fairs are really good. Like the state one, it seems like it was a little disappointing, but I know some can be worth attending, especially if it's the right department. I think like New York has a really good one, for example. I've had a couple mentees attend that one. They really loved it. Or if you do a company-based one or like a industry-based one, sometimes there's healthcare, right? Healthcare-based career fairs. Other career fairs to look for are ones that maybe your college will host, alumni association will host, so keep them in mind as well. Networking, I'm going to be networking and going to the Sophie conference tomorrow in Long Beach, the Society of Public Health Educators in Long Beach, California. They have chapters nationwide. So for those of you who are CHES or health education specialists or community health workers or anything in health education, you can look them up. They have chapters, but I will be there. And then I'm also attending the Sisters in Public Health Mixer, right? So that's a networking event to me worth, going to, because you get to meet your colleagues and learn about their work and where they're working and their interest and what you can learn from that. So I think it's a mix of, to me, places that are worth going, but I don't want to just blanket and say all career fairs are good because most of them honestly can just confuse you. So just be mindful of the company that's hosting it, the sectors that's hosting it. Now, career fairs is a business. Like I do see career fairs just being posted up for just about any industry. So that's why you have to be careful on like not wasting your time, I guess.
Thank you. I guess like how do I kind of find career fairs that are happening that may be meaningful for me? Like, do you have any ways to track that?
I've been searching, I want to do a better job. In fact, I might need an intern for this is I think I honestly, the new version of Public Health Hire 2.0 is to help keep track of these kinds of like networking conferences, meetings, opportunities, right? So like it really depends on your interest. You go, if you're looking for more research oriented people or epidemiology related people, or there is different sort of groups that you can follow. I know LinkedIn is a great resource for groups. I don't know if you've been poking around enough to find your sort of groups. But there's also companies that I follow that are worth following. So do you feel like you're searching through there enough?
Honestly, I think I've been following everything that comes my way.
Okay.
I think I have too many things that are in my feeds.
You're like, I've lost track of who I No, but I'm it's on my radar to try to find a way to help you guys with that navigation, right? Because sometimes there are annual conferences that you don't like hear about all the time, right? You're like, oh, I would have loved to go to that, right? Like that happened to me once when there was a San Diego conference. I'm like, how did I not know about that? I wish someone had told me. So I'm gonna do my best, but I kind of feel like we might need another intern who can help with like researching networking opportunities and posting them kind of like on the website, like a calendar of events, even if they're events that I can't host, maybe they're events in your community that you can attend. So yeah, I think it just takes Google, LinkedIn, following others and see, if there's someone that you look up to and you like their role, see if there's any groups they follow, stuff like that. Yeah, there are a lot. There's a lot out there because there's state chapters, there's societies, there's workforce development, like related associations, right? It depends on how savvy you get. Cynthia, what do you think about temp agencies? Yeah, I love temp agencies. I don't feel like I talk about them enough. I just did a post on LinkedIn around a couple temp agencies. I recommend Partners in Diversity, as well as healthcare staffing professionals, although everyone might be taking a little bit of a hit as a temp agency, just as a caveat. There was another one, Haluna Health. They used to be Public Health Foundation Enterprise, Public Health Foundation Enterprises. That's how I've known them, but I think they've evolved to Haluna Health. As well as, again, Partners in Diversity, healthcare staffing. So anyone you find that is temp agency, as long as there's a lenience towards like healthcare, or keep in mind, a lot of these temp agencies actually work with state and local funding as well, right? So I don't even think they might be hit by the federal funding. It just really depends on their work stream. But my understanding is the three that I'm thinking of right now, they tend to work with like LA County and Missouri, and like I've seen them post for Tennessee, like they post for random. I think they work on the local level for that reason. So yeah, let me put them in the chat, temp agencies. In fact, some of my mentees have gotten jobs through them, like significant enough to either stay there and pivot or grow. So I don't try to point mentees. That was like their call. Like we'll find it. And I'm like, oh, but it's temp. And they're like, oh, I'll try it anyways. Right. Like it's, they applied and then it kind of worked out. So temp agencies, love them. Partners in Diversity. Healthcare staffing professionals. And try Haluna. Oops. Yes, Alicia, let me know too in LA. LA is a hub. It's weird. I'm actually trying to get my mentees together in May. We're gonna call it the May Mentee Meetup. The May Mentee Meetup. So Angie, my intern, is helping to schedule that, but I'm hoping to at least get us together, like have a nice brunch or lunch or something where it's just connecting with each other. Because, I think all of us right now are yearning for more in-person opportunities, especially as things keep evolving post-COVID and in the current administration. We're all just trying to hold on to each other, I think, which is fine. We need that. Like, we need that. Okay, yay, Courtney's about to join us. People in the waiting room. Questions? Any updates anyone wants to share? Hi, Courtney, welcome. Just the last day of mentorship enrollment. So I'm getting people last minute enrolling. So make sure you decide whether you want to join. Be mindful, by the way, that you can also activate the enrollment later on. I have 2 mentees already who signed up who won't even activate their mentorship until they're graduating, and the other one, they want to take a vacation because it's been crazy for them. So they're like, I can't talk about it yet, but I want to work with you. So let's talk in May or June. So if that's where you guys are at, that's fine with me. You guys can just book your mentor session later on in a few weeks. Keep in mind the next enrollment period won't be until the fall. So this is really your enrollment period for that spring, summer period. Like if you guys need a job or need to build that momentum now before the fall, this is the enrollment period to consider. Okay.